Hey guys, and happy new month. May officially is my favorite month of the year. It is the month that I started working like officially as a registered nurse. So May 2024 actually marks a full on year of me working as a registered nurse. It is so surreal to even think that it's been a year since I started working as a registered nurse. So in this video, I'll be covering a few things that I've learned as a new registered nurse that you can actually use if you're still a student, but also to my fellow classmates, colleagues that are in their first year or the first few years of being a registered nurse, and sort of what to expect and what I have learned. A little backstory. The first shift that I actually ever did was in Grooteskiet Hospital in a psychiatric ward, which technically wasn't my first time being there because I had been there as a student in my fourth year. Then the first shift that I ever did in private was a hospital that literally was right across my old high school. So I had seen this hospital for like a full on 3-4 years while I was still in high school, and I'd always idolized this hospital. Like, oh my gosh, this hospital is beautiful. I absolutely want to work here. So it was just, for me, as now I was thinking about this video, it was very interesting for me. I'm like, oh, my first shift was actually in a hospital where I did my training, and the first private hospital that I was in was a hospital that was across my old high school. So looking at all these scenarios, here's a couple of things that I've learned. The first one is you've got to ask questions. Even though I knew this hospital, I'd idolized it for so long, and I'd actually worked in a surgical ward before, and also I'd worked in a psychiatric ward before in the hospital that I'd spent literally 4 years of my training in. I knew what to expect. I knew what sort of environment it was, but there was still a lot of things that I didn't know, because as a student we are shielded from a lot of things that you have to be able to do as a registered nurse, because when you're a student you are literally shadowing someone. The RN in the unit is literally doing everything for you, and you're only learning like a small part of what it means to be a registered nurse in that ward. So now when you walk into a ward as a new RN, you now have this weighted shoulders on you of having your epaulets and having the title of registered nurse. So it's a lot more, so it's a lot different, because now you're expected to be a shift leader in some instances where it's your first shift, you walk in, you're the most senior nurse, and you feel like, whoa, okay, I'm so inadequately prepared for this, because one, you feel you're young, two, you are inexperienced, which you are. So it's very important for you to know that you are allowed to ask questions. So the only way you can survive those first few couple months while you're trying to find your feet is you've got to ask questions. That's why I took like the first couple months that I started working as a registered nurse, I made sure that I was learning, whether that was asking questions of my colleagues in the hospital, asking the doctors, the physiotherapists, what are they doing, what is this for, and actually asking Uncle Google, like, why do we do this in the ward? Why do we give this medication? What is this medication for, etc.? You'd have seen a video that I did over here of me studying medication in hospital, because obviously in the private sector, it was a whole lot of different things that we had never used in a government sector. So please do not be afraid to ask questions. I know the first couple months we sort of have this thing of, oh, but I'm a registered nurse now, I'm supposed to act like it. Yes, you can act like it, but you can still ask questions. So it's important that you ask questions. Trust me, the people that you work with, they are more than willing to give you the answers and able to educate you on how to be a proper RN, but you will never know if you don't ask. And as you're going through this motion of you are learning how does all of these things work, you get to a stage which I think is like by month 3, if not earlier, where you've gotten into the rhythm of things. You know, this is the ward routine, this is how we do things, and you sort of get comfortable in how you're doing things. Then there's always a curveball that is thrown your way, whether it's a new medication that you've never seen in your life that you have to administer and you actually don't know how to administer it, or whether it's a procedure that you have to do for a patient that you don't know how to do. So when you come to these moments, trust me, you are not dumb, you are just inexperienced. That was a thing that I had to take on and make it very personal to me, because there was a time when when you are studying, especially in the government sector, we are not taught how to we are not taught how to put up drips or IV insertion. So the first couple months of me being a registered nurse, I could run away from it. I could ask other sisters, "Oh, sister, can you please put this up for me? Can you do this for me?" Because I was so nervous, because I'd never learned it. I'd never been trained in how to do IV administration. So I actually had to ask my agency, like, "Can you guys teach me how to put up drops? Because I can't survive for the next couple of years of my career not knowing how to put up IV administration." And I didn't want to practice it on my patients without ever having to practice it on a dummy and that sort of thing. And there were also other things that I had to do, like, for example, when a doctor wanted to put up a CVP line, or when a doctor wanted to put in a chest drain. I had never done that my whole training and the whole career that I've had as a nurse. So you will have those curveballs thrown at you, but you must just remember that you're not dumb. You know what you're doing as a registered nurse, but you are just inexperienced. So if you have opportunities to learn how to do these things that you've never done before, take the opportunity. Whether you're doing it for your CPD points, or whether you're doing in-service training, or if it's your agency that is providing all these trainings for you, even if it costs you a little bit of money, trust me, go for it. You will never regret it. For example, with me, I did a course with my agency to learn about the IV administration, but also how to be an ICU nurse. I went for it. I enjoyed the training. Tried to work in ICU. It was not for me. I just could not handle the pressure of being in ICU, and I told myself ICU is not for me. But you know what? The training that I learned within my ICU certification, I'm using it in all the wards that I'm working, but ICU, just not for me. If you can take up those opportunities to equip yourself with the skills that you need, trust me, it will help you in the long run. Because all the nurses that we think are great nurses, that we think they know everything that's happening in the unit, it is because they've had the years of experience of practicing these things, and now they are equipped. So we can actually get to that same level. We just have to put in the practice. So I was on TikTok the other day, just scrolling, and then this video popped up on my feed. Watch quickly.
That video is actually mad funny, because that's a real life representation on how them doctors feel when they read those notes. I would never forget when I saw a provider get so mad at my note that provider actually went in and wrote over my note to try to cover them. I don't know how that's possible, but they did it. And this just goes to show you, when your license is on the line, everybody is getting thrown under the bus. Like, nobody is safe. Yes, I told the doctor has yet to respond, the doctor has yet to put in new orders, and blah, 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 because we all know that in every hospital, it's always the nurse's fault. Everything always falls on our shoulders, so you got to cover yourself.
Yeah, so the reason why this video fascinated me and I wanted to bring it up in this video is that sometimes I think as nurses, we forget that doctors actually read the things that we write up about our patients. So yes, write it because the doctors is going to see it, and yes, we need to protect ourselves, but also just write it for your own reference, because sometimes when you're doing doctor's rounds, you write down the things that the doctor said. Sometimes we forget. So it's always easier for you to go and see, okay, the doctor said this and this and this, and you have a record. Also, the other thing is doctors sometimes do their rounds and they don't actually write what they said in the rounds. So it's important for you to have that record, because one, the patient is going to ask you. Two, when you're doing your handover, the nurses in the next shift are going to want to know, what did the doctor say when they came for their rounds? So write it in. The other thing is, if a doctor comes and they do rounds with you and they go to a certain patient and they're not changing anything about their treatment plan, just write, the doctor came to see the patient, they inquired about how the patient is finding their current plan, and doctors feels it's best for the patient to continue on the current plan and to move on with it. Because what I noticed is, if you write no new orders, and the doctor is going to come back to you and say you are lying, because they did say something. They might not have added anything, But the fact that they came to see the patient and they asked the patient how the treatment is going, that is an order that they've put in. They're continuing with the current plan. So always document. So I know sometimes the doctors, they'll add like a lot of details or go on long tangents with the patient when they're talking about how the life is going and whatnot. Just add what the patient said, what the doctor also said. And the other thing is document the things that your patients say to you when the doctor is in absence. There's been many cases where patients come to you as the nurse, they complain, they make comments about the doctor, how the doctor is late, when is the doctor coming, I want the doctor to do this and this and this and this. Then the doctor comes and the patients don't say any of those things to the doctor. The doctor leaves. Now the patient comes back to you and say, oh yeah, I wanted to tell the doctor that. Then you look at the patient like, okay, so then why didn't you say all of these things when the doctor was there? For me, the patients that frustrate me the most is the ones that get so pissed at their doctors for not pitching up on time, doctors being late, whatever. Like, they have a lot of complaints about their doctors. But when the doctor pitches up, they never say any of those things. So it's important for you as the nurse to record what your patient is saying, because one, your doctor is going to see it. Two, when the doctor is there, discuss those things that the patient has said, so that it doesn't come back to you as the nurse in terms of, oh, the nurse didn't say anything, because technically you're supposed to present what the patient wants. So if you don't raise up those things, the doctor's not going to know. So document it to save yourself, because the patients will sometimes turn around and say, I never said that. So if you document it, you can bring it up with your doctor. So it's important that you're protecting the doctor, which is important, protecting yourself and your license, and also protecting the patients in what they say, so that you can discuss the further plan going forward. The next thing is you need to have an organized system on how you treat your day or how you treat your shift. For example, with me, we obviously come into the shift, you do handover. For me, I feel it's important for me to go greet my patients. So obviously you do the allocation, you're told you have these patients. I go to my patients, even if they're sleeping, I just go to see how they're doing. Are they breathing? Are they on oxygen? Do they have any IV lines? Is there any medication that is still running? Because sometimes the day or the night stuff, they will put up medication and it's still running by the time they leave. So it's important that you just go check, is it still running? Has it finished? So you can close the disconnected patients and just see if your patients have any other devices in them. In addition to that, it's important for you to verify what your staff say to you, because there has been instances where the nurses say the patient has this device in. Then you go and check the patient. Oh, the patient doesn't actually have that device anymore. So it's important for you to just verify that. Okay, cool. So we hand over, we go see the patient. Then I write exactly how I saw my patient. Patient has been taken over from the night staff or has been taken over from the day staff. Patient is currently sleeping or the patient is currently awake. They're breathing on room air or they're breathing on a nasal cannula, oxygen or whatever. They have this and this devices. That's your handover report. You've taken over what the patient is like. Once I've done my checks, then I actually can start doing my medication, which is the 8 o'clock medication. Then, at 12 o'clock, you've got medication again. Then at 4 and 6, you've got medication again. Then at the end of the day, I make sure that I write my handover report of this is what happened with the patient during the course of the day. This is the devices that they have now at the end of my shift. Then you also make sure that your care plan is also updated. Then you hand over your patient to the next shift. So having a system that works for you, that allows you to be able to complete everything that you need to get accomplished that day, that is systematic. It helps you to make sure that you're keeping track of everything that you have done for the patient, which will help you when you're doing your handover reports and also when you're handing over the patient to the next staff. 2, it helps you to keep a track of the things that you have done and the things that you have not done to make sure that you don't miss anything. And also 3, it just helps you to keep a record of the things that still need to get done, because we all have those days where the day is just chaotic. There's so many things that have to get done. So having just a report or having a list to go with of how you're going to record your day and how you're going to manage your day is important, because trust me, how your system works will also affect how your colleagues are able to work with you. Because if your system is very haphazard, is very disorganized, it's going to affect how your colleagues are going to work, because one, you're not going to finish your work on time, or you're going to be getting in the way of how your colleagues are going to be working if your routine is all over the place. So having a systematic and organized way of doing things will, trust me, help you to save time and make sure that you're accomplishing everything on time. So the next thing we must discuss is doctors. They are your colleagues, they are not your bosses. I feel like as a new RN, we sometimes feel very scared interacting with doctors. Well, that's how I felt, especially in the private sector, because you sort of feel like, they might get you into trouble if you do something wrong. Because you do get doctors that have got very bad attitudes towards nurses. They're very picky about how they want certain things, or they only want one nurse to do a handover with them and that sort of thing. You will find those characters, but it's important for you to know that they're your colleagues. So you're allowed to discuss things with them. You're allowed to disagree with them about the treatment plan that the patient is undergoing. You are allowed to call them out on mistakes or things that they've omitted or things that they haven't done. And you're also allowed to make mistakes in their presence. You are human. They make mistakes, and so you're also allowed to make mistakes. This is about having a teamwork of nurses, doctors, and all the other members of the multidisciplinary team. So do not be scared to be around your doctors or doing anything with your doctors, because I get it. There's days or there's certain doctors that just makes my heart, like I skip a beat when they walk past, because I'm like, this doctor is here, they're going to make my life very difficult. But they're not your bosses. You are reporting to your unit manager, and they are reporting to however their structure is like. So you are allowed to talk to them in a very respectful manner, but you're also allowed to disagree with them. So do not be scared of them. You're all working in a team to make sure that you're providing the best care for your patient. So this one I'm very guilty of. I am learning to overcome it, but it's definitely something you guys must not fall into the trap of. And that trap is not having a work-life balance. It's very, very, very easy to make your whole life revolve around your work. And that mostly happens when you can never say no to working overtime. And I get it, we all need the money. Sometimes there's really nothing else to be doing at home. So you tell yourself, I might as well be at work getting some money. But don't fall into the trap that your whole life is just work. Especially for us that work via agencies, we never know when our next shift is going to be. And even if you're on a regular shift, you might always get cancelled. So you always have that fear of like, what if this is the last shift I'm going to have for a while, because things are going to get quiet and that sort of thing. So don't put yourself into that pressure of I'm never going to have shifts, because one, you're limiting the power of God in providing for you. Like, he's been giving you jobs for a while now, so don't limit him in that. But also don't put that stress on you and working 7 days in a row. Trust me, I've done that multiple times. Don't do that. Still go to work to make money, but also still allow yourselves able to enjoy the money that you are working so hard for. The other thing that I've noticed is there's some people that even when they're off, they will still come to work for some reason, like even if it's just a random visit and whatnot. And I'm like, cool, people are dedicated to their jobs, but I don't get it. Like, why are you here on your off day? And it's not like it's a one-time thing. Like, they will do it frequently. And I'm like, why? Like, you're off. Be off at home. Go do something. So for me, that I don't get. And I mean, I do get there are those that their whole life is about nursing, because either their kids have moved away or they've never been married and that sort of thing. So I get those special circumstances, but still go do something else outside of nursing. And I get it. Nursing is a calling. It is a passion, something I'm passionate about. I love nursing. I love everything that's going to do with it. but please still create a life outside of your job. That's not who you are overally. There's other aspects of you that I'm sure you want to explore. So please go explore them. Work-life balance is still important, even after school. Please, just go do it. So, when you are still a student, or if you still are a student, there's certain ways that our supervisors and our clinical facilitators would teach us how to do certain procedures. Then you end up in the clinical facility and you try to practice exactly what you've been taught, but it doesn't really fit, or it's not how things are done in that facility. And I get it. Yes, the universities and the clinical facilitators, they want to teach us how to do things in the best way to provide the best outcomes for the patients. However, in the real life experience, it's not always the case. We don't always have the material to do things as it's done in your assessments and that sort of thing. So my advice to you is you need to compare, evaluate, and then implement. So you need to compare what's happening in the real life and what you've been taught in your university, your college, etc. Then you need to evaluate, in a real life scenario, what is the ultimate goal that I'm trying to achieve here? Can I achieve it using what I've been taught at university? If not, how can I maneuver what I've been taught in university to make it fit into the real life experience and thus implement what you evaluated? For example, in university, when you're doing your vital signs, you're taught that you do your blood pressure, then you do your temperature, then you do your pulse and your respiration together. But in a real life experience, you are literally doing all four of them at the same time. Because one, you attach the blood pressure cuff with that oximeter thing, which means you're checking your blood pressure and your pulse at the same time. Then you put the thermometer under the patient. All of those three things are happening at the same time while you're looking at the patient, getting your respiration. So all four things are happening at the same time, which is literally in a space of 10 to 15 seconds because you've got the dynamic there. So in a university setup, yes, they might tell you do it all one step at a time, and there's a whole thing of, hi, my name is so and so, and there's a whole long procedure that comes with it. But in a real life scenario, you must simplify things. So keep the things that are the most important, and every other fluff, get rid of it. So for example, introduce yourself to the patient, tell them what you're going to do, get permission, put your devices on, count your respirations, take it off the patient. Thank you so much. Your blood pressure or your vital signs look good, and you move on. So moral of the story is, take what you've been taught, take the most important aspects of it, implement it on the patient so that you are saving time and you also are providing the patient with the best care, the best allocation in the scenario, and you move on. Because in a real life scenario, things move fast and you don't want to be doing a procedure for half an hour that could have been 10-15 minutes. So the other day, we had a nurse in the shift that was retiring after 35 years of working in the nursing department. Congratulations to her. Absolutely love her. So in having a conversation with her, we were just asking her, like, sister, what things would you tell us as the new generation of nurses that are coming in on, how to survive nursing? And one of the most important things she told us is, do not be a pushover. You went to university to study for 4 years to be an RN. Don't let other people push you over, because you did those 4 years. And for me, it was especially important because I feel like as agency nurses or as agency RNs, we are sometimes taken advantage of because people sort of have this thing of, you're just a visitor in our ward, like we don't really care. Or you've got nurses that have a lot more experience than you do, but they are not at the same level as you. For example, your ENs and your ENAs that have a lot of experience. Yes, they know how to do a lot of things and there's nothing wrong with that. But sometimes they overstep their boundaries or they overstep their scope of practice because they have experience and they sort of want to feel like they can push you over because they know more. And her response was, I get you have your experience, but I'm the shift leader here. I'm the one with the NQF level. If you wanted to give that authority, you should have gone to study for your NQF level. And I know it sounds rude, but the premise of the thing is you went to university to study. You're the one who had the sleepless nights studying for your degree. You're the one who went and you got your epaulets. That means you deserve to be in that shift. You deserve to be in that place working as a registered nurse. So don't let people push you over thinking, oh, because I have the experience or because I have more years of experience than you, I can push you over. You are the shift leader. You're the one with the NQF level. So don't let them push you over. Even if you're at the same NQF level, you are equally deserving to be in that place. Whether you're an agency or a permanent staff, you are equally deserving. You did your work and you studied. And if they didn't need you, they wouldn't have hired you. Hence, since they need you, you don't have to be pushed over by anyone. So as a new RN, I know you're going to feel scared, like, oh my gosh, I'm so new here. And most of us will feel like, oh my god, I'm so young, I'm only in my 20s. I don't want to be dealing with all this hostility in the hospital setup and that sort of thing. But don't let anyone push you over because you're equally deserving to be in that space. And the last tip that I can give you, or it's kind of a 3-part scenario, in conjunction to the previous tip that I just gave you about not being a pushover, you must equally also learn how to manage people the same way that you manage work. You're going to come to a scenario or a situation where you are the senior staff in the ward. You are going to be the shift leader in the ward. So one, you need to know how to allocate people, how you're going to split the ward, how the work is going to get done. If something is not get done, you need to know how to be firm to people and say, this needs to get done. Can you get it done now? Even though the people might be older than you, they're old enough to be your mother's older sisters, whatever, you need to be able to manage people to make sure that your shift gets things done before you hand over to the next staff. The other thing is you need to learn your policies. There's certain ways that a hospital functions, there's certain ways that a shift or certain ways that a certain ward does things in terms of how they do their codes, which is you doing your CPR. What happens in an emergency? You need to know if a certain procedure, like if it's a urological procedure, gynecological procedure, orthopedic procedure, if this procedure is happening to a certain patient, what is the protocol that you follow? Is there bloods that needs to be done? Does the patient need to shave, etc.? You need to know those procedures and those policies that needs to be followed, because you don't want to send a patient, or you don't want a patient to get admitted and the things are not done, which will get you into trouble as the shift leader because things are not done. Yes, the first couple months you're not going to know, but as you learn these things, write them down. Also, in your wards, there's going to be policies that are actually written down. Go and read them, document for yourself so that you know how these things must be done. But obviously, it comes with experience. And the last thing that I'm going to say is you need to learn to start thinking as a shift leader, because the day will come when you're the most senior staff member on the shift. And you need to know what it means to be a shift leader. What are the certain administrative things that needs to be done? Whether that involves booking of certain things for patients, making sure that there's enough staff, making sure that there's enough stock, making sure that there is the patient handover reports, ordering medication, and that sort of thing. So you need to make sure that you adequately know how to be a shift leader. The first couple months obviously put you on probation. There's always someone with you that is the most senior staff member and that sort of thing. But your day will come, and the first day you walk into that hospital, you need to think like a registered nurse, but you also need to start knowing what it means to be a shift leader, because the day will come. I hope these tips will help you as a current student, but also for those that have started their shifts or have started their journey of being a new registered nurse and eventually going to be a registered nurse with a lot of years of experience. Obviously, this list is not exhaustive. So if there's any things that you have learned as a new RN that you like people to be very aware of, definitely comment down below. I'd be interested to see what are the things that I missed or other things that I can also learn from you. But please enjoy your journey of being a registered nurse. It is so much fun. There's so many things that you learn, but obviously you need to be smart up here while you're also enjoying your passion of being a registered nurse. So until next week, Friday, 12 p.m. South African time, have an awesome one. Bye, guys.